Hello everybody, this is Josh Mastenbrook from the Michigan Region 5 Medical Control Authority Network, bringing to you a brief overview of the new emergency system protocol for telemedicine and stationary treatment of low acuity patients during COVID-19 outbreak, as well as a brief tutorial on eBridge. The intended audience includes paramedics and medical control physicians from Region 5 in Southwest Michigan, which includes Allegan, Berry, Van Buren, Kalamazoo, Calhoun, Berrien, Cass, St. Joseph, and Branch counties. So on the screen is Protocol 833. This is the new emergency protocol dealing with telemedicine and patient non-transport. As an emergency protocol, this protocol is only in effect for 60 days. The background of this protocol really is to try to reduce unnecessary EMS transports to the hospital emergency department during the COVID-19 outbreak, while still assuring appropriate healthcare services are delivered. So let me go over a few definitions. An emergency patient, this is a patient that has acute symptoms with sufficient severity that a reasonable lay person might conclude that the person's health or a fetus's health is in serious jeopardy, or that there could be serious impairment of bodily function or serious dysfunction of a body organ or part if not taken to the emergency department. A non-emergency patient is a patient that has been jointly assessed by EMS and the medical control telehealth physician, and they're determined not to meet the definition of an emergency patient. An alternate destination includes a health care facility other than the emergency department, and these are approved by your local medical control medical director. These might include physicians' offices, clinics, urgent cares, for example. Alternate transport means a vehicle other than a licensed ambulance that is used to safely transport a non-emergency patient. These might include things like a wheelchair van, private vehicle, shared rides like Uber and Lyft, other non-licensed public safety vehicles. So let's move on. Who qualifies for this protocol? So patients that have mild respiratory infectious symptoms, including a mild sore throat, mild cough, and muscle aches, or mild respiratory illness with wheezing without signs of infection, so like an asthma exacerbation patient or a COPD exacerbation patient with mild symptoms. Patients with vomiting and diarrhea without signs of dehydration or shock. Mild exacerbations of chronic medical conditions. Minor traumatic injuries such as abrasions, minor lacerations that don't need repair, or potentially minor accidental burns. Some sort of orthopedic injury, including sprains, strains, and contusions. Other minor medical complaints that wouldn't necessarily be a true emergency, including simple urinary tract infections or minor skin infections. These are just examples. Now, some medical control authorities may only want you to use this protocol with potential mild suspected COVID patients, while other medical control authorities are allowing their medics to include other low acuity patients as described in this protocol. You should get information from your medical director, which will give you further information regarding how they would like this protocol implemented in terms of using it for all low acuity patients versus just the mild COVID patients. Now, there are patients that are excluded, and these include patients with significant abnormal vital signs that don't resolve with initial treatment, hypoxia less than 92% on room air, chest pain, labored breathing, altered mental status, significant acute pain of unknown origin, or other conditions that appear consistent with an emergency patient, or patients that you feel after your assessment do need to go to the emergency department for further evaluation. All those patients would be excluded. Additionally, if while on consult with the medical control physician, the physician feels that the patient needs to go to the emergency department, that would be an excluded patient from this protocol as well, and they would need to be transported to an ER. So what does the process look like? So paramedic unit gets dispatched, and they arrive on scene and evaluate the patient and begin treatment as directed by appropriate medical control protocols. If the patient appears to be an emergency patient, you'll want to continue with your treatment and transport as directed by medical control protocols, like you would in a non-COVID period of time. If after evaluation and treatment, the paramedic feels that the patient is a non-emergency patient and does not need to be evaluated in the emergency department, but could rather be evaluated at an urgent care or primary care physician's office, those would be the patients that you would want to use the telemedicine consult for. Now remember, patients that are refusals or any other questions about protocols, you would want to follow your normal medical control consult process. In Kalamazoo County, that would include contacting MSU1, and in other counties would likely include contacting your local emergency department for further direction. So this protocol and the use of telehealth via eBridge is just for patients that you feel do not need to be transported to the emergency department that meet the inclusion criteria that we discussed. I will take you through the eBridge app shortly. If after the end of your consult, all parties agree that there is not a need for transport to the emergency department, a plan will be made with the patient, and this could include following up with the primary care physician, going to an urgent care, or staying at home and isolating. If the patient is staying at home and has infectious respiratory symptoms, such as the flu or COVID being suspected, that patient should be advised to try to isolate themselves as best as possible from other non-ill people in their household, as you certainly do not want to have that patient pass on this respiratory infection to other household contacts. If the patient is going to be returning home from a public venue, the patient, if supplies are available, should be given a surgical mask so as not to infect others in public on their way home. All right, let's move on and take a look at the eBridge app. So this is the eBridge app. This is on my iPad, so it may look a little bit different depending on the device that you're using. So when you open the app and you are going to make a teleconsult to a medical control physician, you're going to want to tap on the Region 5 non-transport icon. This will open up this form And you'll want to fill out this form as best that you can. Note that there's name, age, gender, primary care physician, patient's phone number, county that you're in, the medical control authority that you're in, the agency, crew member name, unit number, chief complaint, and then free text for vital signs. So after you complete this, then you're going to touch attach. That's going to open a camera, and you can take a picture if there's something that you need to take a picture of, such as an injury. Otherwise, you're going to hit cancel. And then you're going to hit next. Then this is going to open up contacts. This contacts list is going to look different based on your agency. So within a county, a single agency can see all other ambulances that are part of that same agency, and will also be able to see certain medical control physicians. So you're going to want to scroll down to medical control. And again, I have a lot more to select for on my screen here than you'll likely have on your ambulance screen. So here we are to medical control. And the one you're looking for is Region 5 physician. So I'm going to tap that. This now is going to open up a email looking form that's going to be sent to the Region 5 medical control physician. If I want, I can tap down here in the body and type a message. Otherwise, I'm just going to hit send. It's going to say sending and then message sent. And that's going to go to the Region 5 medical control physician. That physician is going to get an alert on their side and will acknowledge it by selecting a toggle switch. At this point, either the physician can call you back or you can call the physician. To call the physician, you're going to click on this camera icon and then scroll down and select your Region 5 physician. And now it is calling them. So now you can see that the Region 5 physician has picked up, and now you can do a consult with them and Dr. Aguilar. Then you'll have your discussion with the Region 5 physician and come to a final decision about the patient's disposition. So once you're done with the call, then you're going to click leave at the top right, end call. And that is it. Now for the medical control physician, you're going to want to be able to do some MDM documentation, and that form also needs to be sent to the medical control physician once you've documented on it, so that the MCA where the patient originated from can review the call. So to do that, you're going to tap this clock looking icon. That'll get you to your messages. You'll want to find the message that the medic just sent to you. So I'm going to say medic 902 had sent me a message, and now I'm all finished with the video consult. So I'm going to go back into their note, and I'm going to hit up here in the upper right. I'm going to hit forward, and this is going to allow me to forward this message with my MDM typed in to the medical control physician in the county that the patient originated in. So in the form here, I'm going to type any comments that I had about the encounter and my MDM. And when I'm done, I'm going to hit request acknowledge, and then I'm going to hit the to box, and I'm going to scroll down to the medical control area, and I'm going to select the MCA where that patient originated in. So we'll just send it to myself for now. So after I do that, then you're just going to hit send. And that's going to send that record to the MCA physician. The MCA physician can then open up that record and review it. If you have any questions, please feel free to reach out to your medical director or to Michael Bentley.